While Warren Jones is bringing his panel up, the second panel, thank you, Betsy. Want to I already thanked the National Forum team, without whom this meeting would not be happening. The other set of people, very important stakeholders, without whom this meeting would not be happening, is the sponsors of this meeting. So thank you very much for the support that makes this meeting possible, from Amgen, from AstraZeneca, from the American Heart Association, from Asperian, and from Sanofi Regeneron. Our next panel will be led by Dr. Warren Jones, Captain Warren Jones, of Provider Resources, who is a former president of the American Academy of Family Physicians. And as the panel's getting seated, Warren will get us started.
Okay. Good morning, everyone. I'm excited to be here this morning to be a part of this tremendous panel, and I'm sorry that it's being live streamed. Those of you who know me know that I have a face made for radio. So it's going to be an interesting evolution this morning. I wanted to just take a moment to share with you that with this panel, we're going to be looking at the impact of cardiovascular health and the impact on national security. It's one of the things that we don't really think about. For our discussion today, we're fortunate to be joined by a truly distinguished panel. I'll provide some brief comments about them, and you'll find a lot more about them in the booklet in front of you in your program. To my immediate right is Captain Kimberly Elenberg. Captain Elenberg supports the DoD Combatant Commands as the Director of Total Force Fitness and directly supports the National Defense Strategy. It's critically important to make sure that we have someone in that role with the health background she does. As an example, she earned a bachelor's in nursing at Temple University, a master's in informatics from the University of Maryland, and a doctorate in nursing practice from Johns Hopkins. Makes me angry she did it summa cum laude. If I can reach up and touch the hem of your garment. Welcome, Captain Elenberg. Our second presenter this morning will be Mr. Ben Goodman. And Mr. Goodman serves as the National Director of Mission Readiness and leads a team that works with over 750 retired flag and general officers as they focus on evidence-based solutions to helping our children grow up to be healthy and live productive lives. Welcome, Mr. Goodman. And our final panel member this morning is Ms. Lori Tremmel, Freeman. And Ms. Freeman is the Chief Executive Officer of the National Association of County and City Health Officials. She holds an MBA degree, and prior to joining NACHO, she had a distinguished career, including serving as the CEO of the Association of Maternal Child Health Programs and other significant positions affecting public health and well-being of our population. So this morning, we're going to just take a step back. When Surgeon General Jerome Adams spoke to us 2 years ago at the National Forum, he told us that one of his top 3 priorities is raising the recognition that wellness is at the heart of the safety and security of our nation. He has testified to Congress that it's estimated that 7 in 10 youths ages 17 to 24 would fail to qualify for military services due to obesity, educational deficits, or behavioral health or criminal history. In order to ensure a strong national defense, we need to ensure threats to service members are eliminated, threats to their recruitment, to their retention, to their readiness, and that their resilience challenges are mitigated. So we're going to begin talking a little about that reality of that interface between our national defense, our national security, and the role that they play within our communities. So I'd like to start off with you, Captain Elenberg. How does the health of a civilian community affect today's service members, in your opinion?
Well, first of all, we have, sorry about that. Thank you.
No problem.
So first of all, when we think about national defense, it's a multi-pronged approach, right? With diplomacy and alliances playing huge impacts. Having a strong military is also a great deterrent, and helps to balance, peace and the ability to work together collaboratively with other nations and countries. So it's incredibly important. But it's an all-volunteer military, which means that individuals choose to take that opportunity to serve their country in that manner. And people are a reflection of the communities in which they live. We have mapped back the health records of our service members to where they do live. Our reserve component, meaning National Guard members and reserve components, are more significantly reflective of the communities in which they live. But so are our active duty service members. So where we live, where we work, where we play, certainly has an impact on our health and well-being.
Thank you for that point. And Mr. Gordon, could you share with us from your perspective in working with the tremendous cadre of former leaders in active service and their perspective that they share in the work that you do together?
Absolutely. Thank you again for the opportunity to be here today. Mission Readiness started 10 years ago around that same statistic that Admiral Adams came and shared a couple of years ago, which is the concern that today 71% of young Americans between the ages of 17 and 24 could not qualify for military service. And our members saw that as a real threat to the future of the all-volunteer force. But we're not here to get kids to serve in uniform. Our members know that the military is a microcosm of society, as Captain Elenberg just said, and that to grow that recruitment pool, right, we've got to make sure that all kids are healthy, well-educated, and on the right side of the law. So our members continue to be concerned that obesity is the leading medical reason that young Americans can't qualify for military service. And that's why in 2010 they got together and were very instrumental in passage of the Healthy Hunger-Free Kids Act, which changed what kids are eating in American schools. And they've been at it for the last 10 years, working to safeguard those smart changes to school lunches, but also to increase physical activity in schools, both PE, but also general physical activity, right? Advocating for things like safe routes to schools to make it easier for kids to get on that right track. Because what we know is, if we look at injury rates and everything else, a kid can't enter the armed forces at 18 and shed 18 years of learned bad habits and poor choices. It may be the military's problem that it inherits, but it's not on the military to solve. It's on all of society to solve those challenges.
Shared responsibility was whispered under the breath. Excellent point. Excellent point. Ms. Freeman, is it correct to say that a strong national defense depends on a strong public health? It's on. You can just speak into it.
Yes, I think that's absolutely correct. And as individuals in our community, if we're not healthy or fit, we can't live a good, healthy life ourselves or perform in our jobs or with our schoolwork for kids. So that message, parlays into the military community as well. And the military members who have to be ready and ready to respond at any given time to an emergency or just perform their normal work aren't in a position to do so if they're not healthy or fit. They're compromised if they are.
And can you discuss some of the programs that your organization utilizes to help to ensure that we improve the quality of our public health status in our communities?
Sure. Well, local public health departments are part of the overall system of governmental public health, but the uniqueness of local health departments is that they're on the ground working in their communities, within their communities, convening partners in their communities to address community health issues. And they do this in a number of ways. I think the most important way is through community engagement, through community health improvement programs and community health assessments that directly involve community members in identifying the problems in the communities and then coming up with the solutions to address those problems. All of that is done at the community level in the community. And in terms of cardiovascular health, it's really important because of the components around shared responsibility and partnering with other sectors in the community to get these programs in place and to get them done. For example, local health departments have to work with urban planners to make sure there are safe streets that that children and adults can bicycle and walk on and exercise effectively in their communities. So they're in a unique position to impact community health, and I think there's probably more work that could be done with local health departments working in the community with where there are active military installations to partner on interventions that improve cardiovascular and other.
Excellent point. And I want to turn to you, Captain Elenberg. There's some things that are uniquely occurring within your community. Please share with us some of those ideas.
Okay, well, so one of the things that we did was we wanted to know where our people are and what they're most at risk for, so we could begin a good dialogue with the state and county public health departments and non-governmental organizations. And so we worked on epi maps that are, helping us with identifying folks. We mapped back the health-related quality of life to the electronic health record and found that it was a statistically significant indicator of the ability to meet readiness. And it also breaks things down. You could do a regression analysis on the components that roll up to make the health-related quality of life to figure out where those risk areas are. And if you take that and map that back to state health improvement plans or county health improvement plans, you can find where there are common or shared interests. The ontology might be different. The county might say, we really need to address cardiovascular health by addressing diabetes or things like that. We might be saying we need better height weight standards so we know that individuals are not going to have musculoskeletal injuries. But if we don't address height weight, we know down the road that is going to impact cardiovascular health. And so bridging the ontology and saying we have a shared common interest, which is improving the nutritional value and the physical activity of our population so you can achieve your goals, we can achieve our goals, gives us that bridge for dialogue. And we're doing that in partnership with the CDC, the National Association for County Disease Directors, and too many people to even call out. But I really want to recognize that opportunity. And we've been invited as a result to sit and participate on several of the state health improvement planning boards in these pilot states where we're doing this. So we can help influence and increase awareness. The one point I did want to make is that many service members don't live on installations anymore. They live off of installations, about 70% of the active duty. So finding those communities where they live and which are most at risk helps us triage, just like in an emergency room. Where do we, need to target resources and target time, right? The other thing that's really critically important is a state like Minnesota, and I think we have someone from Minnesota in here, but yes, sir. A state like Minnesota actually has a huge reserve component population, but they don't have a military installation. So knowing that is also really important, and if we can help increase the awareness for states and counties of that, it'll be very helpful. Many times they ask on their surveys, are you a veteran? But they don't necessarily know to ask, are you serving currently in the military as a reserve component member or on active duty? And that's really important because if the state is aware of that population being there, then we can direct communications or we can direct resourcing or address laws that may impede access to some of the resources in the community that support cardiovascular health. Because, for example, an active duty service member may be a resident, a home of record in Pennsylvania, but may be stationed here in Virginia. And if residency is required to access county or state resources, they could be precluded. So that's what we're doing under our Building Healthy Military Communities, and we are just incredibly excited to work with the states and the counties and the NGOs. We think that this is a great partnership and opportunity.
That's a wonderful program to talk about. A lot of people don't really understand the increased reliance on Guard and Reserve that our active duty requirements and components have now. And so, Mr. Gordon, could you share with us your view on what can we do to help American communities change or better support the way that we can make service members available and help other individuals with their well-being so that if they choose to serve, they can be able to serve effectively?
Yeah, no, absolutely. It's a great question. And, I think one thing to think about too, when we talk about the Guard population, for example, right? Americans don't immediately, they should, but in this conversation, sometimes we don't think about disaster responses. We've been very active, for example, working on some of these obesity issues in North Dakota, where there's flooding, almost on a pretty regular basis. And it's not just about thinking about who's ready to go off and serve, in that active duty population, but how can we respond and help folks at home? It's about what I touched on earlier. It's on our communities to build good, healthy, preventative habits at an early age. Now, I'm not a doctor, and I understand that these issues are complex, but we know that for the vast majority of kids, right, if we can get them on the right track early, they're going to pick up those good habits as they go on through life. We really think the magic bullet is early childhood education, to getting at all of the major military service disqualifiers. We know that the kids that are in a high-quality early learning program, right, the most at-risk kids, are not only going to enter school ready to learn when we talk about those educational barriers, but when we talk about things like or barriers like obesity, those kids are more likely to move more at a younger age and pick up healthier eating habits at an early age. So from our perspective, communities can really be making it number one, investing in helping kids early, but number two, making it as easy as possible for kids to move through life to retain those habits. We know that then when they're 17, 18 years old, they're going to be ready and healthy to go on and do whatever they choose.
And actually, living healthier earlier, they'll be better able to run track, play football or basketball, and do some of the other things that they want to do to really enrich their developmental stages of their education. So it plays a significant role across the whole lifespan. And Ms. Freeman, I was wondering, besides the public health needs, besides the public health community, who do we have to turn to? Or who can we turn to help to make sure that we can get the kinds of healthy communities that really provide opportunities for our young people? Yes.
There are so many different potential partners that when you bring them together, you really can make some important changes. For example, that helps. So education, working with schools on healthy eating options for kids, exercise options. When I was over at AmChip, we were engaged in a project that in Arizona, I believe it was, that had tax incentives for preschools that offered physical education at the preschool level. And so those kinds of policy types of interventions can be really helpful in education. Law enforcement, working with justice and law enforcement, as well as housing, safe and healthy housing, which I appreciate the comment about the military living off of the bases, but ensuring there's healthy housing available for them, both on and off of those bases, as well as urban planning and groups like that. I think those partners are already engaged in communities across the country. The local health departments, I think, I have a statistic that indicates that 75% of the time the local health departments are the backbone organization pulling together, convening these multisectoral partners. And so I think we have an opportunity to consider, the military another partner in those efforts and make sure they're not a forgotten population within the community, and in addressing some of the the overall interventions through this multisectoral approach is a good one.
Thank you. It's really important to look at non-traditional partners, as you talked about, and that cross-sectional team that can make a difference. For instance, if you've got large stores in your community, why can't they dedicate a section of their parking lot where it's a safe place that people can walk? And oh, by the way, take them into the stores to have some seminars on healthy eating. It's a way to make public-private partnerships, business partnerships, that make a difference in a totally healthy community. But many times communities are led by mayors. So I get to play Alex Trebek and say, here's a toss-up. Do you think mayors can make a difference in the health of the community, and how do you think that can be leveraged for greater success?
One of the things that we have found is that leadership has a huge influence, trickle-down effect on communities. And people are excited, they are motivated when leaders are willing to get out and do things with the population from behind their desk and in with the population. They can have huge impacts, and those can be leaders like mayors, but they can also be leaders that are in business. They can be leaders in the schools, whatever it is. In particular, the youth like positive attention. They like attention, right? Let's face it, they love attention. And if we can give them positive attention and get out and actually do things with them, that would be great. And I think mayors are a really great place to start.
Thank you very much. Ben?
Well, I'm a fan of the old adage, right? Tip O'Neill, all politics is local, and I think that's true when it comes to leadership and health policy, right? And, when you look out across the country, there have been great success stories like Mayor Bill Purcell in Nashville and trying to really invest and urge communities to prioritize efforts to help kids walk and bike to school, as we talked about. So I think it's both local leadership where folks turn, but I think it's also a good opportunity when people look and see Washington is dysfunctional. There are local leaders who can make good investments and prioritize local infrastructure or programs or just use their platform.
Laurie?
I just echo, mayors they're part of the system of governance in the community, and they yield a certain power and influence that can be used positively to bring about change in the community. They can work with county boards of supervisors and as well as chambers of commerce and across those partners, and I think really be influential in how communities address some of these issues.
And one of the things that's been talked about is helping to have healthier young people is a multi-generational problem. So are there some low-hanging fruit that are available to communities and the military to work together to help to change the trajectory of the health of our young people, to help them to get in the position to live healthier lives and have an option of serving the nation?
I think one of the things that we find very valuable is volunteerism. Right? Retaining that sense of purpose as we go through life is critically important for our overall well-being, and it certainly impacts our cardiovascular health. And so I see it as a win. When we look at things multi-generationally, if we can really encourage opportunities for volunteerism across the generations, now we have the opportunity to establish mentorships. We have the opportunity to pass down some of the knowledge and wisdom that we have. We also have the opportunity as part of the growing older generation, right, to learn from our youth. What is it that they care about? When we talk about messaging to them, how do we know how to message to them if we're not part of them, if we're not interacting with them? They are our future, right? We've been there, we've done it, we have the T-shirt. We need to help prepare leaders for tomorrow. And individual leaders and leaders for our counties, our communities, our country.
Ben?
One thing that I think is so neat as we travel the country with our retired admirals and generals and visit school settings is how some of the new learned behaviors and exposure to new foods and opportunities and ways to live healthy lifestyles that kids are learning in schools, they're bringing home to their parents. And so, while I think sometimes we think about kind of the top down, as Captain Elenberg just said, there's a lot we can learn from our young people. I was at a school in New London, Connecticut, just outside the Coast Guard Academy with the former commandant of the Coast Guard, and a 5-year-old turned to us who were at a school lunch, and offered us some of his kale Caesar salad. And I turned to the Admiral and I said, you know, this kid is 6. I didn't learn about kale till I was 25, right? But I think there are lessons that we can learn both ways. And I think what's really great is when we think about these community initiatives to expose folks to new ideas, kids are going to adapt to these new ideas. Maybe they'll be a little resistant, but they may adapt before some of our older community members do. It's a two-way street.
Mm-hmm.
Lori?
I would just add there's an opportunity, I think, to engage kids in the conversation about what is going to work for them. And, you know, I have 20-year-old twins right now, and it was really hard raising them in this environment that we're in right now. They're distracted by so many different things. Their schedules are insanely crazy. Finding the time to do something as simple as exercise or, you know, have healthy habits is just increasingly difficult. But maybe asking them what would work for them is a novel idea, perhaps. I think also, you know, it's not as easy as really implementing something new for a new generation, especially when we consider the disparities in the health and the non-medical environmental type conditions that create health or don't create health have to be addressed so that everybody has choices. And sometimes it's not a matter of making the right choice, it's about having a choice. And if people don't have a choice of that they can buy, you know, fresh foods or not eat at a fast food restaurant in their neighborhood or be exposed to poor environmental conditions in their home, how can they make the right choice?
This is a very weighty subject we've been talking about, and I've got one last question I'd like to ask you before we open the floor up for questions. As a foundation for that question, when you look at the area of the country that has percentage-wise the highest percentage of recruits coming into military service, it tends to be the southern states. And actually, when I was on active duty, I learned that the largest concentration of retired general and flag officers was located in Mississippi, where I now live. When you look at the cardiovascular risk factors in that area, it really has a significant impact on the area, on the ability to attract healthy individuals. What kind of thoughts do you have that haven't been addressed already that might be effective in helping communities to really put their young people in a position to have a choice of serving and living a healthier life? Captain?
So I think the key word that you just said is choice. I can tell you when we were in Mississippi, there were a large number of youth who wanted the opportunity to volunteer for the military. Some were driven by the sense of service. Some were driven by the desire to have health insurance for the very first time or the desire to have an education. My mom was not well. She was not healthy. My grandparents had passed. I grew up in an orphanage it's for orphans or social orphans. It's called the Milton Hershey School. And you had to be significantly below the poverty line to count, to be able to go to that school. And my mom could not work at the time. It was a choice: chemo treatment or working. It was the laws just weren't the same then. I wouldn't be sitting in this chair today having the opportunity to share what I've learned with you if it were not for the opportunities that I had in the military. So between Milton Hershey School and the military, I have health insurance. My children had an opportunity to go to university. I'm sitting here with a doctorate from Johns Hopkins, right? I am so grateful for that opportunity. And I think that it's a crime if we don't support our youth and their health and make sure that if they want to make that choice to volunteer to do this or to have other jobs, then we have fallen short. It is really important to invest in them, and particularly from an equitable perspective. We need to make sure folks have these opportunities.
Thank you so very much. Ben?
Well, you know, Next week in Norfolk, we're going to release a new report on nutrition and obesity. It's part of a nationwide campaign across 8 states, including Mississippi, where we're going to be going around really trying to change the narrative on public nutrition programs and physical activity and prevention to really ensure that folks, policymakers, decision makers, influencers understand that when we're talking about programs like the school lunch program or other programs that provide at-risk families and kids with key nutrition programs, that we really are talking about the backbone of our country and our armed forces. You know, I've mentioned the school lunch program a couple times today. One of the reasons that our organization is so big on that, right, it's where kids get up to half of their calories during the day. But the military helped to create the school lunch program in 1946 because it was too many service members drafted at that time during the war had been malnourished from the Great Depression, and it was General Hershey, who was the head of the Selective Service, testified to Congress and said, we should really be thinking about this way to get kids the nutrients and the calories they need. Now, over time, the school lunch program, right, put too much of an emphasis on calories rather than what the kids were eating. But where I'm going with this is, you know, when we talk about public nutrition programs and you know, getting kids the calories, the good calories they need, and preparing them for success. You know, these programs are about the future of our health, of our military, but for our country as well. And it's really about getting out and changing the public narrative. So we're excited for partners as we lead this campaign, but lean on folks to really understand just the long-term implications of these policies that can seem pretty abstract when we're just looking at numbers in an Excel sheet.
Laura, anything you'd like to share?
I don't think I have much to add. I think just the idea of braiding resources and partnerships to leverage the work across the community is really an important way to go with this. There are lots of silos at work in the community, and I think we could do a lot better to leverage partnerships to make some headway in these areas.
Thank you. So now's your opportunity to ask questions of these experts and share your ideas. Don't waste your time asking questions of me. Yes, Laura.
They're live streaming, so yeah.
Thank you, sir. Hi, everyone. Laura Gordon with IAC for Children and National Forum. So I wanted to just throw out an observation when we were talking about, you know, young people and keeping them interested in physical activities. That I live in Montgomery County, Maryland, a gigantic county with a lot of diversity, and I have now kids who are older teens or college age. But I noticed with sort of great disappointment that, you know, when they were young, there were lots of team sports available for kids. So a lot of the county leagues and the informal things rely on volunteers for coaching and that sort of thing. And we were really grateful because that became not only something active for them, but a social network as well. And they really found that important. The minute we got to middle school, everything became competitive. Suddenly you had to try out for the school team. There were only a very few of now the volunteer leagues and such. And again, they relied, that was largely, I think, because parents wanted to stop volunteering to do this. In high school, it's non-existent. If you are not competitive and able to make the very competitive high school team, almost no opportunity to play soccer or football or volleyball or field hockey. And so my kids dropped out, and it wasn't because they weren't interested. It was because they weren't good enough to make the team, and then there were no other opportunities. So I just wanted to throw that out as I bet that's pretty common. And it's ironic in the time when our kids, we need to prepare them as older kids to continue to be active and perhaps join the military or otherwise be, ready for any branch or opportunity that way, that we're actually offering them less opportunity at those older ages. And I wonder if that's something, especially that maybe NACHO or others might be able to address at the community level.
I would like to take a shot at this because I had the exact same experience that you did, and it was so incredibly disappointing to me as a parent. Not only because I want my kids to be involved, but it was disappointing to them too, not to be able to play in a sport that they loved at the high school level. I think that this is a policy issue. You know, one thing that I noticed at my kids' school too is that physical education was an elective, and that has changed over time and in the wrong direction. I think that physical education should be part of the core curriculum of all levels of school, and that we have gone away from that has really done a disservice, I think, to our kids too, in terms of the ability, even during the day, just to remove themselves from a thinking environment to a more physical environment, just to get that release. I think it has all kinds of repercussions. So I would love to explore what policy lever would look like that on a national level.
Do you want to add to it? Okay, anything?
Oh, I think there's an opportunity here for families as well, right? So it is disheartening when you only have so many hours in a day, and they're in an environment, in a structure where some of these opportunities are not offered. And it's a big problem, particularly where you have large schools. The larger the school, the more the challenge is for making these teams and things like that. So while we work the policies in the communities and with the schools, and that really takes partnerships with the states, because the only driver we identified to leverage behavior change in the schools was the Food and Nutrition Assistance Program that is run through the Department of Agriculture, right? Because that's tied to funding. It's an issue that's going to have to be worked at the state level. But while we're working it there, I would encourage us as families to do what we can to think about how we can increase our physical activity with our kids and subtly introduce to them those behaviors, those eating behaviors, those physical behaviors that will help to prevent cardiovascular disease as they get older. I was just out in Paso Robles at a wedding, and I happened to have all three kids who are all grown with me, and I thought, well, we're going to get up and go ride horses. And so I tried to do what you were suggesting, where I found what would interest and entice them, and get them up even after the night of a wedding to get out the door and actually eat carrots, right? So I wanted them to eat carrots and ride horses. I'm trying to send subtle subliminal messages. But we might feel like we don't have power and influence over our families or our communities, but I think we have more power and influence than we realize. And so the more involved we are in our families and communities, to your end, advocating at that local level for local policy changes, we should go for it.
Yes, sir.
Good morning. My name is William Patterson. I'm Director of Public Affairs with PCOS Challenge, the National Polycystic Ovary Syndrome Association. Thank the panel. It's been a great discussion. I had a question, and I'd be interested in your thoughts on if there are any nuances in the delivery of your programs in terms of, for instance, with women with PCOS, 75% of lean women with PCOS are insulin resistant, up to 95% of women who are overweight or have obesity are insulin resistant. And when programs are implemented, let's say some of the diet and exercises, those women and girls may not respond the same way or as fast as others. Is there any nuance? And one of the thoughts that came to mind is also women who are in the armed services. Some of them have to make tape, and because of the insulin resistance, they carry more weight in the abdominal area, and it's more difficult for them to make weight, and some go to some pretty extreme, to make that, because their COs are, may not understand that they have PCOS, and it's more difficult. So those people who are running these programs, do they understand that, again, not everyone will respond the same, and is there any messaging for them not to put extra pressure on these folks that aren't responding the same way to,
So we're looking systemically. One of the things that we're saying is, what is the mission essential task that an individual or a unit is expected to accomplish? and what is an appropriate approach to support those service members so they can achieve that task. So somebody who does, cyber force is going to have really need to perform cognitively very sharply. And we know that's affected by things like nutrition, right? Somebody who's infantry is going to have to do other things from a physical activity perspective. And so optimizing their performance is unique. So we are trying to be more thoughtful about what does it mean to be fit for that mission, right? So that we can have the enduring human performance required to accomplish it. But we're also looking at policy like federal policy. How do we, and I think this plays off of what we've been talking today in regards to the youth, right? So we have youth and we look at school lunches. But then after we graduate, we often go to university or other technical schools, or we go into the military, we have dining facilities, or we get employed and we have dining options with our employers. How is it that we calculate how much funding we're going to spend on food? By what method do we do that so that we have the right fuel or the right food in these facilities where we're still shaping behaviors as people become young adults, right? Or even older adults. And the way we've historically calculated that is based on market basket value, right? What is the cost of maybe 100 different food items? And then we say, okay, given an average burn of 2,000 calories a day, this is how much we will then spend on food. But if we start to look at communities a little bit more uniquely, what is the community, what is the activity level of that community, and we take into consideration the calculation of nutritional requirements, right, as well as performance requirements and market basket value, I think we can start getting the right food at the right place at the right time for different populations. And so that might not address your specific concern of individuals with a particular challenge, but I think it gets to the broader scope of what we're trying to do to think of many individuals with different and various challenges and their opportunity to perform. So I hope I answered your question.
Specifically with regard to the people who are implementing the programs, and
Yes.
do they understand that people are different, and that if you give them a mandate that says this is the nutrition plan or this is the exercise plan,
We are understanding that one size does not fit all. So in a nutshell, all that stuff I just said, yeah, one size does not fit all for certain.
And I had the pleasure of serving 28 and a half years in uniform. I can tell you that force readiness equaled individual readiness. And true commanders learned how to communicate with their individuals in their units to help them to identify the challenges they faced and come up with innovative ways of helping them to overcome it. There is a sensitivity, but it's very difficult to move the needle on a unique condition like the one you're describing. Just know that there are efforts underway to meet people where they are and help them to get to where they need to be. Thank you for your question. Final question, please.
Hi, Daphne Delgado, Trust for America's Health. Can you talk a little bit more about, you mentioned a lot about the National School Lunch Program, but the interaction with other entitlement programs and these populations, whether they're enlisted forces or people who could potentially be recruited. I'm thinking about things like SNAP and WIC. They're so fundamental to how so many Americans eat. And there's been a lot of efforts to roll back a lot of those requirements. So I just wonder if you have any ideas about access to those programs and the nutritional requirements in those programs.
Yeah, so we absolutely see those programs. We see the school lunch program as the backbone of good nutrition policy for young Americans, but we see those programs as absolutely a critical part that kind of go alongside. You know, look, we have 750 retired admirals and generals who can be good external validators for a lot of these problems, can say a lot of things that folks in uniform can't say. You know, our members really look and are focused in this campaign we're about to launch. This new report you'll see next week, we'll talk about all three of those critical programs. We are very careful in how we talk about current proposals and policies and you know, things floating around out there, because our members really want to focus on talking about how critical those programs are and leave some of the give the space to decision makers to ensure that they hear their message. Certainly happy to talk with anybody offline about this, but the bottom line is those programs are absolutely critical, and our members are focused on ensuring that the populations that need access to those programs get that access, because that's how they're going to grow up to be healthy, prepared citizens, whether they choose to serve in uniform or go on and do anything else.
Yeah, and we have, one of the things that we get very excited about, both internal to our Department of Defense efforts and externally with the states and counties that we work with, are practical programs. How do you cook on a budget? There are very practical things. So there are policies that can make a difference. There are business practices that can make a difference. And then there's practical programming. And when you have programming and you can show the evidence of the effect of that programming, you can not only improve things like nutrition, things like physical activity, you can build community, build social relationships, and contribute to all of those things that will lead to improved cardiovascular disease, or not improved cardiovascular disease, but improvements in decreasing cardiovascular disease.
Well, actually improve the recovery from it as well. So thank you very much.
Exactly, yes.
And Lori, any final words?
Just that obviously we're big supporters of those programs, and at the community level there's a lot of innovation with those programs going on to ensure access and nutritional value of those programs. For example, in East Texas, they're about to deploy mobile WIC units to take to the users of the WIC program to erase some of those barriers to access that exist for some folks to get to WIC units in a health department or self-standing ones. Also for nutrition, a lot of communities are partnering with farmers markets and grocery stores to incentivize SNAP users to buy fresh fruits and vegetables. I just came across a program yesterday where there was a $30 incentive twice a month on a SNAP program if you went to your food line and you bought fruits and vegetables. You got extra $30 worth of food. And so those innovations are occurring locally all the time.
And it's been a wonderful experience to be here with these tremendous experts this morning. But I want to share with you again that our purpose was not to offer the answers and solutions, but to begin the dialogue and to stimulate communication for collaboration. This is a multifactorial problem. We have the ability to generate the solutions, and we look forward to working with you and for you in the process. Thank you very much, panel, for being an excellent group you've all.